confident with a mask on, and then I just feel like a literal lopsided ogre underneath. So yeah. So I don't have a lot of time, but I just wanted to quick get on here and update you guys on where I'm at. I'm still extremely upset over everything, and I'm gonna try and film this video from like straight on, where you can see like my ears are even, my nose, my eyes are even, like everything is even, just so you can see my concerns, because every single video I've been posting like sideways like this, so you can't tell. I appreciate like all of your kind comments and like telling me that I look better and things like that, but I haven't shared like what I'm truly going through and how I'm truly feeling. And yes, I've shared with you guys, but I honestly like haven't shared the extent of it. So I figured I would just get on here and share things from my perspective and share what I'm going through. I think getting your feedback and like your opinions helps a lot. So I'll share with you guys like what my doctors told me and just where I'm at, what my options are right now. Take everything I say with a grain of salt. Like, I could be right, I could be wrong, but I just want to share what I'm going through and my perspective with you guys. So yeah, basically you guys all know like my face has felt extremely lopsided since the day that I could open my mouth after surgery. I just felt like my smile was off.
It's the first day that I can kind of like open my mouth a little bit. I'm super concerned about my midline. So like your midline is like the middle of your teeth. Mine is all the way over here, and the center of my nose is like over here. And it's like over here, so it's super concerning to me. I kind of want to like message the doctor and ask if that's normal, but I'm not gonna bother him. I'll just wait until my appointment. But yeah.
It's really been bothering me. I finally went and saw my surgeon. I basically just like laid everything out there. I said like I'm really unhappy with the results. My face feels extremely lopsided. My face feels uneven. My smile feels like it was shifted over. Laid it all out there like full 9 yards. I said I'm embarrassed of the way that I look. I don't take my mask off. I don't take pictures. Like, I truly think something is wrong. My face is just all shifted this way. My smile is shifted this way. My nose gets these like weird flares. And just everything is shifted that way. Told me like it's only 1 millimeter or 2 off and to fix it with orthodontics. And I told him like my orthodontist is not comfortable shaving and shifting my teeth, doing IPR to cover it. Like, she recommended I get veneers. He told me he does not recommend I get veneers, but he says if she won't shave my teeth and shift them over, then to just find an orthodontist that will do it and get treatment with them. That's not really an option for me. Like, I've already gone through 2 rounds of orthodontics. I had braces before this surgery, and I got Invisalign put on specifically for the surgery. So I got passive aligners beforehand, and then we were just supposed to make like any minor adjustments to the bite afterwards. So it's not cheap. I paid $7,000 for my Invisalign right before this surgery, and I consulted with an orthodontist in New York before as well, who I really admired and who like explained things really well to me, and I wish I could have gone with them. But their quote was $17,000 for Invisalign, so that one was out of my budget too. So basically, I've already spent $7,000 on orthodontics, and I cannot go through a full another round of treatment. And I feel like I shouldn't have to do that. The doctor said like if the money was what I was worried about, just to go on a payment plan with another orthodontist. I just turned 23 last month, and the last thing I want to be doing is working paycheck to paycheck, paying off another round of Invisalign or a cosmetic surgery. I want to be using my money in like traveling or paying a mortgage or investing it. Like, I do not want to be stuck on a payment plan for a third round of orthodontics. I was honestly like to the point of tears in his office, just telling him how unhappy I was with my results, and he offered to do a full reversal surgery if I wanted to go back to how I used to look. Said if I really couldn't get it fixed, then we could discuss a revision. And then he said he could do my nose. He said he could do an Nasal-Based reduction, which is where they make incisions here and here and just like narrow the width of the nostrils. So that's kind of how we ended things. I was feeling much better after going to my appointment, just because my doctor like saw me in person, and you really can't deny my concerns when you see me in person. Like, it's apparent that my smile is just shifted this way. Yes, my nose is shifted that way, but my nose, I think, has always been a little bit that way. Like, this little center of my nose has always been over here, but my smile was just always lined up with my face, like over here, and now my smile is lined up with the nose. I left my appointment, and then I got an email from the doctor later, like with all my information, and I'm just gonna read you guys the emails actually, because it honestly just makes no sense to me. Maybe I'm missing something. Maybe you guys can give me your perspective. Okay, so this is my conversation with the doctor after my appointment, and tell me if I'm crazy, because I'm like really upset, and maybe you guys can tell me like, oh, like, yeah, you are wrong, the doctor's right. Hi Rachel, your virtual surgical planning is attached here. The numbers that we discussed are circled in blue. Essentially, the midline between your upper teeth, upper incisor midpoint, was moved 1.7 millimeters to the right. This movement corrected you to have a 0 millimeter left-right deviation from the facial midline based on your facial bone and skull base. The chin point was also moved 1.6 millimeters to the right to correct an asymmetry and coincides with your upper incision midline. Although 1.7 millimeter movement to the right was made, I think a movement of about 1 millimeter to the left is what you described as ideal in the office. It's a small amount, but we both want it to be perfect. In my experience, movements like this are managed in the post-op orthodontics, and minor adjustments are expected and a normal part of jaw surgery. If you cannot seem to find an ortho that fits well with this case, then we can discuss the revision procedure. The surgery will be similar to last time, but not as much swelling because the movement will be smaller. Personally, I would have ortho done, but I understand how you feel. We can also address the nasal width if you feel it hasn't settled by then. I want you to feel as good as you look, and if you don't, then we should find the best way to get you there. Just to recap options. Option 1. Orthodontics with referred orthos for 1 millimeter midline adjustment. This is my recommendation. I can call any ortho you choose and discuss, including the ones that I have recommended to you. Option number 2, revision surgery for 1 millimeter midline adjustment and nasal-based narrowing. We can do this anytime you want at this point. I will include you on the virtual surgical planning call, and we can make the plan together. Surgery will take 1 to 2 hours, and I will keep you just overnight in the hospital. Option 3, allow for further settling and reassessment at 1 year post-op. I don't expect the midline concerns you have to change. The nose and soft tissue will continue to settle, however. That was that. Sends me like all my measurements and my before and after pictures. I respond to my doctor. I say, hi doctor. Thanks for all the info. I'll take time to look over everything tonight. I hope me being analytical doesn't come across the wrong way, because I do respect your aesthetic viewpoint. That was the reason I chose you over others in the first place. Can you please send me the before photos from my initial consult as well? Thank you so much. Because like the before pictures that the doctor is using are like the worst pictures I've ever seen of myself. Like, I wouldn't even think that was me. And he had like other pictures, so I just asked for my other before photos. Doctor responds, says, hi Rachel, thank you for your confidence, means a lot. Don't apologize, appreciate your eye for detail, and I just want us to both fully understand what we are seeing, because asymmetries can be complex, and the way we see them is also complex. The doctor sends me more pictures, and like one has like a thick blue line drawn down my face. So he says, Rachel, we can use these if we decide we want to adjust anything. It really looks like we actually improved a leftward asymmetry of the upper teeth and chin, and you are more symmetrical now. Facial asymmetry is complex because there are many elements such as the eyes, nose, ears, brows, lips, teeth, and chin that have to be balanced, and they are never in perfect symmetry in anyone. I also think you look absolutely amazing, but it's more important that you think that. At the end of the day, it's most important that you are safe and happy in that order. Lastly, my aesthetics and judgment have to be in line. Study these and we can talk about it via call or Zoom. The doctor sends me like a picture with like a blue line down my face, and because he was like, oh, like I just want you to understand like what you're seeing and all of this. So I look at the pictures and I draw like my own lines down them. Maybe I shouldn't have done that. I just wanted the doctor to like see things from my perspective and what I was seeing. So I respond to those pictures with the line drawn down my face, and I draw like my own line, and I kind of like try to share my perspective of what I'm seeing, because he said like asymmetries are complex and he just wants to make sure we're both seeing the same thing. Me being me, I sent it back to the doctor. I took my before and after pictures from my ortho and his. Here's my take on it. Let me know if I have the wrong understanding / perspective. Here are my initial and most recent orthodontic records. I attached an image with no markups, one with black lines drawn directly in line with my midline, and one with blue lines down the ideal midline, lined up with the glabella and mental point. Let me know your thoughts. And the glabella is the center of your forehead, and the mental point is the center of your chin. It's just like my self-education using these terms. I hope I use them correctly, but that was that. So I sent the doctor these pictures. I'll put them on the screen right here. And the one I did draw slanted lines, which I guess I shouldn't have drawn slanted lines, but I was just drawing the line down my midline. But I guess I did that wrong, which I realize that now. But the other picture I drew a straight line. But I sent the doctor all of these pictures. This is where like maybe I upset the doctor, I don't know. The doctor then responds to the pictures I sent and goes, Rachel, I think your upper tooth and chin midline was deviated to your left pre-op. That line you are drawing post-op is slanted. We cannot slant the teeth with surgery. Only ortho can slant teeth. We move the entire jaw as a single unit, and the teeth move with the jaw, but they do not move independent of the jaw. What you are describing is called a dental cant, not a maxillary cant. It means that the teeth are slanted. I'm not sure that I agree with you. I actually think you look significantly more proportionate, symmetric, and absolutely beautiful. If there are people saying otherwise, they are simply wrong. I'm sorry, they are wrong. You look fantastic. The doctor then sends another message like 20 minutes later and goes, also, to properly assess midline, you have to put your orbits and skull base in natural head position. We can do this during virtual surgical planning with your CT scan easily. Clinically with photos, it's a bit harder, but you should make sure that 1, your eyes are level, and 2, your head is not turned, so ears should be equally visible. Also, your nose should be pointed straight because no DG, the bed up or down will alter horizontal and vertical symmetry with any baseline anterior-posterior asymmetry. I think that was a typo, but that was that. I responded and I said, nobody's telling me otherwise. That was just my personal take on it. Completely okay that I am wrong. I just wanted to share my perspective so you see what I see. Those are the only photos I have from you in the ortho, and I just drew the line to my midline. I'm sorry I did not understand correctly, but thank you for clearing it up. No need to apologize, Rachel. Facial asymmetry is the most complex element of facial surgery. Plus, it's your face. We have to love it. No matter how perfect I may think your surgical outcome is, if you don't love it, it's a failure. Think about things for now, and when you decide on whether or not you would like to redo, revise, or undo the surgery, let us know. We will see you at the 1-year mark or sooner if you want to come in before then. Talk soon. The doctor basically just said, let me know if you want to redo, revise, or undo the surgery. That was where we ended things. I just wanted to go home and like talk things over with my friends and my family and just get like everyone's like ideas and perspectives. I personally was leaning towards the revision, and I think that's the only thing that's gonna make me happy, because first off, I don't think a reversal is even possible, although the doctor offered it, and I'm not completely unhappy. Well, I am completely unhappy actually, but like I do think there were some positive changes, like my profile view and the overall facial structure, but it's just very asymmetrical. not comfortable going through a third round of orthodontics, paying all of that money when that could potentially not be the right thing to do. Just because I feel like everything has shifted that way. Like, I feel like even if they shifted my teeth that way, I don't think it would fix this shift. But who knows? I was gonna message a doctor back and tell him that I chose the revision. Then I got a message from someone that says, I saw your doctor's like Instagram post. You look so much better. Your face looks so much more symmetrical. Like, I'm so happy that you're so happy. It's like, what? Like, what are you talking about? Keep in mind, like, I don't follow my doctor. I'm not on Instagram. Like, I don't care. But this person sends me the post, and there's a full post about my case. The picture that he drew with like the thick blue lines on my face, and this post goes like, we did facial asymmetry surgery to correct my asymmetrical face, and all of this stuff. And when I saw this, like, my stomach just dropped. Like, we're in the middle of a conversation. I haven't even answered your message. Like, let us know if you want to redo, revise, or undo this surgery. And you're gonna post this and basically just like disregard every single concern that I had. I was just really upset because, like, I'm literally in the doctor's office 2 days before crying over my results and how unhappy and how lopsided my face feels. And then I see this post. Also, the first time the doctor posted 3 weeks post-op, I messaged him and I said, I really wish you would wait till I was happy with the results before you posted anything about my case. Because I was really upset with how uneven my face was at 3 weeks. And so, like, I just don't understand why he posted again. Was so confused, you guys. I personally, like, don't care what anyone else thinks about me. I care what I think about me. And I think, like, that's what's most important in this situation. Like, I don't care if anyone else thinks I look good. I want to be happy with my appearance, and that's all I want. Like, I'm not going to say anything. Like, he knows I'm upset. I know I'm upset. He knows I'm unhappy with the results. I know I'm unhappy with the results. And that's that. So I honestly just bit my tongue, did not say anything about that. I decided that I wanted the revision. So I responded to my doctor's email. The doctor, I just got home and talked over everything with my friends and family. I think a revision is what will make me happy in the end. I'm very grateful for your eye and the improvements, and I don't want to reverse the surgery completely, but I do think the adjustments you mentioned in option 2 will ultimately make me happiest. Can you let me know how long I would need to wait? I was thinking it would be nice to do while I'm still in ortho, so I wouldn't need another full round of treatment. Thank you, Rachel. Doctor responds to this and goes, Hi Rachel, you're healed enough to do the revision anytime you would like. And then goes, what did you have in mind for the modifications? I'm like very confused by this because this is like all in one email thread, and I'm literally just responding to the options that the doctor gave me. So I responded, I said, great, thank you. Should I call the office? I know you said you could include me on the virtual surgical planning call and we can make the plan together, but, and then I pasted option 2 that he gave me. Option 2, revision surgery for 1 millimeter midline adjustment and nasal-based narrowing. The doctor responds to this and goes, we can do virtual surgical planning together. However, if you only want a 1 millimeter midline adjustment, no one in their right mind would do surgery, as this is typically adjusted with orthodontics. Please look at a metric system ruler to reference what a millimeter looks like. It's about as wide as the letter I on your screen. If you wanted to make other larger movements, we could do surgery again, but for 1 millimeter, we need to find an ortho that you feel understands what you're asking. Either of the ones that I recommended will be able to help you. For nasal-based narrowing, we do not need virtual surgical planning. This is most easily addressed by making small incisions inside at the bottom of the nostril to reduce the width of them. This can be done in the office with a light sedation. It is called a modified Weir excision or Aller-based reduction, as we spoke about in the office. Here's an image of where the scars will be. We usually remove sutures at day 5, but if you're flying out before then, we can use a suture that does not need to be removed. Team, please set up a call with Rachel to schedule an in-office procedure. That was that. So, was so confused at this point because I literally just chose from the doctor's options. Like, don't offer me that and don't even entertain my concerns if it's not an option. Like, if no one in their right mind would do surgery for that, why did you give me that as an option? Like, I just don't understand. I don't write back to that. An hour later, I get a message from the doctor, a screenshot of a ruler with an arrow pointed at a millimeter. And it goes 1 millimeter in parentheses, because I don't know what a millimeter is marked by the blue arrows in a metric system ruler, parentheses, typically a centimeters ruler. I was like so offended by this email, you guys, like, considering like I've had multiple conversations with the doctor about how I think a millimeter is like a mile on your face and how this surgery only moves a matter of millimeters. Anyways, I respond to the doctor and I say, okay, I just chose from your options. Why was that even given as an option in your previous email if it were not a choice? I know what a millimeter is, but thank you for clarifying. Doctor goes, if you want a revision/movement greater than that, 1 millimeter is too subtle to justify jaw surgery. Only mention the millimeter because it's metric system and we use it in surgery, but many people in the US aren't familiar and confuse centimeters and inches, so they are unsure of hatch marks on a ruler. I can call you later today about it and talk about the all-or-base reduction. And that was that, you guys. So my doctor called me. He said he would not do a revision surgery. He now said my face was perfectly symmetrical and nothing was wrong. And that the only thing he would do is my nose, and they basically make incisions here. You have like a scar on the outside of your nose and it narrows your nose. And I told him like I'm hesitant in doing that because if I do anything to my nose, my smile is gonna look even more off and all of this. And yeah, that's how we left it. The doctor said my face was perfectly symmetrical now, and that everything was perfect. So yeah. And obviously, like, I respect the surgeon immensely, but I do think it's important to question things if you think something is wrong. My orthodontist won't fix it, but at the same time, she won't admit to anything being wrong. Like, she will not say anything against my surgeon. They will tell me that something is wrong, but then they'll tell the doctor that everything is perfect. So I don't know. Maybe nothing is wrong, but like, I truly, like, I hate my face now. This is me straight. My ears are even. My eyes are even. Like, everything is even. But my face is just shifted this way. My smile's that way. Everything is that way. And yes, my nose is off. And I'm looking back and realizing my nose has always been off. Like, this centerpiece has always been a little bit this way, but my smile was never lined up with my nose. It was always lined up with my face. But now my smile is just shifted this way and lined up with that nose over here. So yeah, that was that. This is where I'm at. I basically have no options. My options are I go through another round of orthodontics and shave my teeth and shift them all over, which I cannot afford, and I don't think I'm comfortable doing that. My second option is the alar-based reduction with the surgeon, which I don't know if that's going to fix things or if I'm gonna end up even more unhappy, because that's not doing anything with like my nose being off. It's just doing this, which I guess would be okay to do that, not to tilt my nose, because then it would line up with the smile and help camouflage it instead of like making it straight and being off with the smile. So that's my option number 2. Or my last option is maybe just like forget about this. Other people are telling me that I should just live with my smile how it is, but I also shouldn't get the alar-based reduction. Everyone says I should just go see like a certified plastic surgeon and just get a nose job, which is like extremely upsetting, like extremely scary to me, because I've never wanted anything cosmetic or anything like my nose to change. So those are my options. Me if I'm being dramatic, tell me if you think I'm right, tell me if you think I'm wrong. I would love to hear your opinions and your perspectives because I think that really helps me. And I don't know if I'm overanalyzing myself and I'm overreacting. I truly don't think that I am because everybody validates my concerns, but nobody fixes them. So yeah, this is where I'm at. I'm now almost a year post-op and I've never been more unhappy with the way that I look. I don't take my mask off. I don't take pictures. I just want to cry every time I look at myself. I am just unhappy with my appearance, and you really don't understand what it's like to go through this unless you go through it firsthand, and it's upsetting, and I'm dealing with it, but it's just been really difficult. So closing this video off, just tell me your opinions. Am I overanalyzing myself? Am I insane? Because I feel insane every time I talk to the doctors because they like admit that something's off, but then they don't do anything to fix it. So I don't know. Is there something I'm missing? Am I insane? I saw my case on social media, I would be like, oh my god, like that girl was so ugly before and she looks so much better now. Like she got facial asymmetry surgery, jaw surgery, a nose job, all of this, when in reality, like that's not necessarily true. I went into the surgery for jaw surgery and jaw surgery only. Facial asymmetry was never a topic of discussion until after the surgery, until I kept telling the doctor that my face felt asymmetrical. But the symmetry of my face beforehand was never a topic of conversation. And my nose was also never really a topic of conversation. I always liked my nose, and I knew the surgery changed your nose, and the doctor told me the surgery changed your nose. Like, it's just like a normal part of jaw surgery. Usually like a very favorable change in people's noses. Like your nose just like tips up a little bit. It maybe widens a little, but it just like looks cuter in my opinion from every case that I've seen. And that's what I was expecting. But the morning of my surgery, when I was like in the waiting room, like in my hospital gown, I had never gotten surgery before, but like your anesthesiologist comes in, the surgeon comes in, and you have to like sign papers right before. So I'm in the room like doing like the pre-surgery paper, and my surgeon comes in and goes, when we move your upper jaw forward, it's gonna change your nose and it's gonna make your nose slope up a little bit. He's like, your nose already slopes up, and it could cause a saddle nose, I believe he said. So he was like, in the case that the slope is too exaggerated, can I add a graft here to make it less exaggerated? And I told the doctor, I said, do whatever you think is best when you're in the operating room, because I trust your aesthetic viewpoint. And that's what he did. So he did add like a graft in my nose during the surgery. So I don't know if that has anything to do with anything, like the width, the length, anything. But like in the post it says I got like a rhinoplasty. Like that's not what I went into this for. So I feel like that can be a bit deceiving too, because like that was never discussed until literally like 5 minutes before the surgery as I'm signing papers. He just added it to the bottom of the paper. I signed it, and that was that. And then again, like I don't know if that's what caused this to happen to my nose or what, but this is everything. Just know, like, social media can be deceiving. I just want to share things from my perspective with you guys who I've been sharing things with throughout this. I'm not like mentioning any of my doctor's names or anything like that. I ultimately just want to be happy with my results, and that's all I care about. So doctors can post what they want and share what they want and have people perceive them how they want them to perceive them. And I know I'm unhappy, the doctor knows I'm unhappy, and this is it. So Give me your guys' opinions and let me know what you think. Am I insane? I don't know what I'm gonna end up doing. I'm really unhappy. It's been almost a year since my surgery and I've never been more unhappy with the way that I look. And I know a lot of people are like saying like, oh, you look fine, whatever. And like, yes, I can hide it. I can talk like this. I can hide it. But I'm upset that I have to do that. And I want to be embarrassed in my face. I don't want to have to hide my face. And I don't want to have to talk to everyone facing sideways. Like, everyone that knows me knows if they talk to me now, I face sideways. And that's just like my family and stuff. Like my friends, I don't take my mask off in front of them. I truly am not happy with the results. And basically, I don't really have any options. I'm trying my best to accept it, you guys. It's been almost a year and I still haven't. I just wish I could go back and I know I can't. So I'm just gonna have to accept my face. And I know this is like a really difficult surgery for a lot of people and it really affects you mentally. I understand that, and I have given it time and I thought like, okay, I'm just not used to this change and things are gonna get better. Like, it's just uneven swelling, it's just this, it's just that. But things have not gotten better for me and I still have the same concerns, and I'm upset. And I hope one day I can look back at this and be like, oh, like I was so silly to think that way. Or I hope like one day I look back on this in the future and I'm like happy with the way that I look. But at this point, I'm just being 100% honest with you guys. Like, I'm not happy with my results. I feel very lopsided. I can talk this way and I can fake it till I make it. I'm going to take advantage of wearing a mask for as long as I can. Where I live, we don't have to wear a mask anymore, and it's getting really difficult for me because I just want to wear a mask all the time because I'm embarrassed of the way that I look. I can put my mask on, I can be confident, like I am extremely confident with a mask on, and then I just feel like a literal lopsided ogre underneath. So yeah, this is where I'm at. Thanks for listening to me, you guys. Give me your opinions and tell me if I'm crazy, tell me if I'm being dramatic, like tell me your thoughts.
How many times before broken up the day 41 habits formed, but I want you to stay. You know right when you're gone, I can't call by your phone. Oh, the night, it is long, and I'm out here alone. Oh, no, you're going alone. Oh, no, you're going alone. Oh, no, you're going alone. Right in front of me, all your eyes, but the light's gone. Held this glowing candle white, that'll go high soon. You know right when you're gone, I can't by your phone. Oh, the night, it is long, and I'm all here alone. How many times before, broken up the day, 41 habits formed, but I want you to stay. You know
I don't want to speak up at a dinner table anymore. I don't want to talk to people. I don't want to see people.
I
I
can't
don't want to
call
take my mask off. And like,
by your
it's
phone.
gotten worse over the past few months rather than better. Like,
Oh, the
I feel
night,
like most people are insecure at
it
first,
is
and then
long.
they end up like loving the way they look. Me, it was like, okay, like I know I'm swollen, I'm gonna look so good. But I'm at the 6-month mark and I'm so insecure. I hate the way that I look. My style is like not centered with my face at all. And my nose is really big. Just knowing that this is what I'm gonna look like for the rest of my life, it really sucks. And it's really disappointing. It's just where I'm at. Just know that the surgery like does not always make you happy.